Hi, everyone. Hi. This is Dr. Isabelle Amig, your host of Unabridged MD. And we have a very, very great guest today. She's a rheumatologist, Liz Rook, and she is a rheumatologist in actually Grand Junction, Colorado, but she's so much more than that. And I'm so excited to introduce her. Before I do so, just a reminder that Unabridged MD in rheumatology is finally open to see patients. So we are the first direct care rheumatology in Colorado. And what that means to you is that it's a direct relationship with you and not with your insurance. And what that ended up meaning is that we don't need referral, and that you get seen really fast, and that you have access to a rheumatologist in a timely manner. So we can get you to remission and to get the answers that you need. So come on over at unabridgedmd.com and we will be super glad to see you. All right. And now, Liz. So I'm going to just share with you guys how I met Liz, because I think that's really exciting. So social media is wonderful for so many reasons. It can be awful, but if you use it properly, it's really wonderful. And one of the reasons, actually, I kept Facebook, because I was on the verge of deleting it. But one of the main reasons was the rheumatology group of physicians. So woman rheumatology, I think it's Woman in Rheumatology group on Facebook. And the other one is a Physician Mom of Colorado. Those two groups are like just pure gold. And you're going to see what I'm talking about, because basically Liz posted a comment saying that, hey guys, like, you as rheumatologists, haven't you experienced the fact that if we are more grounded in who we are and what we have to bring to our patients actually do better? And so I was like, oh my gosh, that's exactly it. That is the type of care I'm talking about. This is why I'm creating Unabridged MD. And so I was like, Liz, do you want to come on the podcast? We need you. So Liz, I'm just going to share to everyone. So you went to Loma Linda for residency and in fellowship as well, and you're a rheumatologist, and you have 12 years of experience, but you're so much more than this. You're also a coach, a life coach. And, how do you become a life coach when you're a rheumatologist? I just feel like it's pretty much together. Do you want to tell us your story a little bit?
Sure. Thank you so much, Isabel. I'm so happy to be here because I am so passionate about especially empowering women to know that they can thrive in their life and their health and balance. And that's what I do with my patients, and it's what I do with my clients. And so my journey to becoming a life coach is I finished my fellowship, excuse me, and I came into attending hood, and I was kind of like, okay, I've hit every goal. Now what? And I felt like there was just a void there, like we worked so hard to get through medical training, and, we sacrifice like our time and our health and our families, and we're just so focused. And then all of a sudden you're like, ding, you're an attending now, and you get to go out in the world, and you're just like, oh, okay, now what?
That's it. Yeah.
Yep. And I was, dealing with some health issues myself. Like I have some anxiety. I had gained some weight in residency and fellowship, and I was getting back into shape, and I wanted to really hunker down. So I actually joined a weight loss group online, and I ended up becoming a weight loss coach through that. And then through that journey, I was coaching, my clients and my patients basically on weight loss and nutrition and habits and macros and all that fun stuff. And the more I did it, the more I realized there's something else. There's like a mindset piece in there of like what we focus on, right? Because what we focus on expands. And I was like, okay, I need some resources. So I started listening to a podcast about weight loss, and it was really mindset focused. And from there, she kept talking about her mentor, Brooke Castillo, who runs the Life Coach School. And so I started listening to her podcast. And then she has a self-coaching scholars program that's online. It used to be they send you something in the mail every month and you fill out your little workbook. And I'm a really good student. We're trained to be really good students and just do our thing. And so from there, she offers life coach training, which I was doing more stress reduction counseling for my patients, because stress is such a big part of autoimmune disease. And the immune response is so affected by our stress levels. And virtually, we're all human. We all have stress, no matter what flavor it comes in, like family, work, home, health. If we're having a lot of pain, that causes stress. If I know when I'm cranky and I'm not feeling well and I go into a patient room, I even hate to say this, but I'm like, well, yeah, you're hurting. I'm not feeling well either. I don't say that obviously, but that's what I'm thinking. And I realized that's not really helpful to
No.
me or the patient.
Yeah.
So I became certified coach a few years ago, and I had been coaching kind of all along. And I think as physicians, we coach our patients on everything, every flavor of everything.
Yes.
But it really helped me kind of come back into myself and helped me solve my own stress and become more grounded and kind of reconnect my body and my mind and kind of soothe my soul and my spirit and rediscover my joy of medicine, because I have been through several different jobs, and I've been in private practice, I've been in an HMO model, and then like an employed position. And now I'm in a great hospital system that's super supportive. But it was a journey getting there to find like what works for me versus what works for someone else, and just creating that balance and just connecting with my patients. And then like a couple months ago, and I hate to say this, I'm with a group of nephrologists and they're all awesome. And they're just so chill. And I was like, why are they always so chill? And I'm like running back and forth and trying to make sure my patients are good. And, obviously getting a practice off the ground because it was a new clinic for the hospital system. But, I want to do a good job. I want to take excellent care of my patients, and I want to keep the balance that I've created. And it hit me, and literally this has not hit me in 12 years of practice, additional, 5 years of training. So that I can't do math when I'm pressured, 14, I don't know, 15 plus years in the medical community, that we take care of chronic pain patients.
Yeah.
And that just hit me. And I was like, oh, because there's other specialties that don't really see people for pain necessarily.
Yeah.
And stress and pain are so intertwined. And then that goes into like lifestyle and sleep and nutrition and what we do when we're stressed, when we're in pain, right?
Yeah.
Like the habits that we pick up when we're younger that we don't always know that we can change, or we like end up rebelling against ourselves to not change because we're like, you should eat right. You should get this amount of sleep. You should do this. And then, your inner little child brain is a reptile brain, or however you want to call it, is like, hold my drink, watch me. I'm not going to change because you're telling me I have to do something. And so it helped me really just understand that and I kind of knew this, but obviously this because you're all about mind, body, and spirit, which is awesome. It's really hard to focus on our patients and their wellness and their healing when we're not grounded and we're not filled up, right?
Yes.
It's the put on your own oxygen mask first. Fill your own cup so you can pour out to others, and you can't give what you don't have. And so just really seeing my office as a healing place for patients and realizing the words that I say, the energy I bring into the room, how I connect with my patients, more just as human to human. Like, you're having pain. I'm so sorry to hear that. Let's talk about it and see how we can get you feeling better, versus being like, yeah, that's what you got. Sorry. We'll give you some pills, like it's huge.
Yeah.
And we don't get trained on this in school.
Yeah.
I mean, maybe some people do, but I never did. Right. And you kind of develop your own style and approach. But unless you've been a patient or had a family member or a loved one that went through the healthcare system, I think it's almost like we forget that part of our humanity as physicians. Because for me, growing up, I was able to turn emotion off and then switch it back on, but I wasn't really connected to it.
Lucky you. Lucky you. It's funny that you mentioned this. I was first of all, this is exactly it, right? Like this is all what On Average MD wants to be, and is one thing, one pause here. What is the name of the podcast you were listening to for weight loss that was mindset based? And we will put this in the thing, but
yeah, it was. I don't know if she's changed the name, but it was Losing 100 Pounds with Corinne Crabtree.
Okay. And we'll put this on the note of the podcast if you're interested.
Perfect.
And then the same thing, the coach that you went to the life
yeah,
coach.
It's called the Life Coach School podcast with Brooke Castillo. Yeah. Okay. So
Wonderful.
I can send you the links on that.
Yeah, absolutely. And we'll put it so that everyone can have access to it. But yeah, talking about this, I reflected a lot. So you know my story, and the auditors here know the story, which is like breast cancer, stage 4, and it's really scary. But then I was kind of realizing, I was like, I know that I have some patients where literally it was miracle, right? I've had patients where they were in the ICU, they were intubated, and I remember just like almost praying for them to get better. And they did, and it was miracle. When I say, like, vasculitis, the brain, like everything, like in the coma for 2 weeks, woke up hemiplegic and now is totally fine. I had another patient with nodules everywhere, intubated, and ultimately is totally fine, and we have amazing drugs as well. But when I did have my cancer, I started thinking about like, okay, like what is it that those patients got that I want to have as well, just so that I tap into this power that some may call placebo, that Dr. Leonardo Len Calabrese calls the healing effect. And I love that term. And I think that is exactly what you're saying. It's that connection with the doc, that feeling that the doc has your back, that they get you, that you're the most important person at that time when you see them. And I think, and I did a lot of energy work and a lot of acupuncture, like Qigong, massages, craniosacral. And what I found is that doctors are rushed and they are you can make out that they're stressed out. So sometimes I was like, okay, does this mean that something wrong has happened to me? Like, so I would not even when the PET scan was coming back, I would not look at the person, at the doc, the oncologist. I would look at their shoes because I was too afraid that their face would say something that wasn't necessarily what I wanted to hear. And so as a physician, I understand where it came from, right? My oncologist was super excited when she learned that I had the BRCA. Any other patients would not have understood. As a physician, I was like, yeah, she's excited because it's intellectually satisfying to be like, oh, I checked it, even though you're not the type of, the cancer wasn't the type that should be BRCA. But she was excited. And I was just like, this is like, I get where they're coming from. So I get it. I can ground myself for them. But the energy worker, they were all grounded. So they had so much space for me as a patient. And what you're describing is exactly what I was lacking as an employed physician, like where you feel that you're constantly trying to figure out some administrative task, constantly just going from one patient to another, to another, to another. And like you have all of those tasks. Many of them are not really care related. And then you lose your humanity. I really like what you say, you lose your humanity. So what I'm wondering is, how do we bring this to the world? Because I fully agree that this is the healing effect, Liz. Because clearly you have such a you had such a powerful message of saying, we need to bring this, we need this for us. How do you bring this? How do you make this happen? Is it just you're talking to other rheumatologists or other physician, or are you just saying, I'm going to just build my own as a person, as a physician?
That's a great question. I think truly through coaching, what I've found, like I think of myself as like a personal trainer for our thoughts and our emotions and our habits, right? Because the integration, it's like mind, body, and spirit. That's what we get our life from, basically. And it goes back to like psychology and neuroscience. Like we have mirror neurons. So we pick up on other people's energy, and most of us are just not aware of it or conscious of it. But like you said, if the doctor has his hand on the door, he's running in the room and he's not making eye contact, our primitive brain taps into that. And that's like our fight or flight response. And it activates our sympathetic nervous system. And we're like, we go to worst case scenario instantly. And I've noticed just over the years, my patients and our patients, they have pain. We're giving them chronic disease diagnoses, and their brain goes to worst case scenario. And if we don't address that and kind of slow it down and educate, I believe knowledge is power. So I think the first step is just creating awareness and creating that space as a physician, as a patient, just as a person. Knowledge is power. The more aware we are of what's going on in our brain and our body and our mind and our heart, we can then create safety and space to slow down, explore, and then allow ourselves to have those feelings, because most of us don't learn healthy emotional, coping growing up. We learn to overeat, we learn to ignore, we learn to shut down. I'm a huge avoider. My work this last year has been just sitting with my discomfort. It's really uncomfortable. Sitting and relaxing on the weekends was super uncomfortable, right? But it's also learning about yourself and getting to know yourself. And for physicians, we're trained to do certain things. And then we have the outside pressures, like the administration, the systems that we have to work in. We have constraints. And then we have the patients, and they're their opinions, their thoughts, their demands, their pain. And I know for me, like I would get frustrated when a patient would come in and they weren't feeling better. And I was like hoping they were feeling better. I was hoping everything I was doing was helping. And they come in and they're in pain. And I would take it personally.
Yes.
It'd be like, I did something wrong. I'm not helping them. Right. Instead of being like, okay. And part of that is kind of the societal people pleasing that we learn as women too, is like, we got to take care of everyone else. Screw our feelings, screw ourselves. And then we just drain all of our energy, our brain is constantly thinking 5 steps ahead. Yes, I have a patient right now, but I got 6 more waiting. I got to do all these charts. I got all these messages. It's great that this patient's doing okay, but what about the next one? I got to pick up the kids after school. When am I going to find time to work out or, dial in my nutrition or feel better? And I have this nagging pain, but I haven't had time to go to the doctor. And it's so overwhelming as physicians. And the first step that I just preach over and over to patients and, my fellow physicians, and I'm starting to get the word out. I love speaking. I love paperwork and speaking. There's some nerd inside me that's just deep down in there. And so I've been giving talks to especially women's groups and like physician groups about how to decrease stress, to actually create that space and let go of the overwhelm, let go of the stress, and just tap in and become aware of what's going on in our brain, and then how that reflects in our body, how we approach our relationships and our communications. And then once we can slow down a little bit, we can teach our patients. Like I love to normalize for patients. And I just pointed out and I'm like, oh, like, do you see what your brain did right there? It was like, one of my patients was like, well, I'm on 500 medications. And I was like, whoa. I was like, okay, let's fact check that. You're on 2 prescriptions, methotrexate and folic acid from me, and one's a vitamin. But his wife was giving him like 20 supplements a day. But his brain, my brain's super dramatic too. I think all our brains are. Was like, I'm going to be on 500 medications and I'm going to spend all day taking pills and I'm never going to have any quality of life. So just normalizing the whole experience for patients, right? And also like how we approach diagnoses. Like if we're feeling powerless with a diagnosis, like scleroderma to me, like, we played that game of like, what diagnosis would we not want, in our realm? Because we're all hypochondriacs. Like my Achilles hurts and I'm like, psoriatic arthritis, I'm dying. But just to how we approach it, like even with scleroderma, when I diagnose and it's new, I don't say, okay, you have scleroderma, it's a chronic diagnosis. I'm sorry, there's no treatments. There's really nothing we can do. I say, this is amazing. We know what it is. And yes, it's not curative. It is a chronic diagnosis. However, we know what systems it usually affects. We can be preventative. We can come up with a game plan, and you're not alone in this. We're together.
Yeah.
We're working as a team. And like what you were saying with your breast cancer, like knowing that there's someone on your side in your corner.
Yes.
And you're not alone. Even if your family doesn't understand, your partner, you don't want to burden your kids, having your physician in your corner is so empowering to patients.
Yes. I want to just hold you on this about what is the diagnosis that you would not want to have. I want to say like any rheumatologic disorder for me is not that bad. Like I just feel like I've done this for more than 20 years now, because I did it in France and then here. And I just feel that I always tell the patient, I'm like, if you're in my office and you need to follow me, then you are lucky, because we're going to get you there.
Yeah.
I really believe that. And I think that the scleroderma, like, we are remembering the bad scleroderma that we used to have, 5-10 years ago. But it's such a different ball game now, because we have treatments. Like we have ways to slow down the progression and, halt it. And so the earlier we get it, the better, right?
And I should say that game we used to play was like in fellowship. It's like, what diagnosis would you least like? Because patients are really scared, for me, of lupus, right? Obviously, every diagnosis is potentially scary, chronic diagnoses, but people go, they get referred for an abnormal ANA test, and then they Google lupus because someone mentions it. And then they come in and they're already very scared, very defensive, very maybe shut down, like worried about what you're going to say, and just being aware of what your patients are going through and how they're approaching it is so important. Because I tell my staff this too. I say, sometimes our patients are not as polite or appropriate on the phone if they're having a flare because they're hurting and they need help. And they're really nice humans, but their pain is driving the bus right now. You know, and obviously we have boundaries around appropriate versus inappropriate behavior just with any human, but we want to give them a little bit of leeway and a little bit of grace and compassion. Like, if you can't walk and you need to go to work, you're going to be frustrated. You're going to be, you know, feeling urgent, right? And so just having that awareness, I think, is so powerful as just even being in healthcare, but having that awareness and then understanding how what we bring into that exam room affects our patients, and how the patients can understand too, how they approach it and how they're thinking about their disease, their diagnoses, their treatments. Because so many of our patients are like, okay, so I got to take this medication forever. And their brain just goes, you know, oh my gosh, like worst case scenario. And what if what if I lose my insurance and I can't afford it? You know, what if I have to choose between food and medications? Like, a lot of our seniors have that fear. And just being able to like speak to it or say, like, I've had other patients that have been worried about this. Does that resonate with you? Is that a concern for you? And that awareness. And I think the biggest thing is awareness, but I think we have to slow down our role so that we can be aware for and with our patients to create that connection and create that space. But I know, especially since the pandemic, so many healthcare providers were just going and going and going. And it's really hard to understand if you're not in healthcare, you know, like, and everyone was burdened in some way with the pandemic. It was just such a huge upheaval for everyone. But especially when, I mean, more so in residency than, you know, as an attending, but when patient dies, like, we always wonder, is there something else we could have done?
Yeah.
You know?
So I want to pause you here. How do you, I mean, I know it's possible because I've certainly done it, but like in people who have like 15 minutes appointment slots, how do you get to this space of grounded so that you have that space and you hold that space for your patients?
Okay, first I would advocate that any rheumatologist or any provider sets up boundaries and knows how they want to practice, right? Like, I did 15-minute appointments my first job. It was private practice. And a year and a half in, I was totally burnt out. And I was like, I'm never doing this again. And so every job I've had since then, I demanded half-hour or hour appointments. And if my patient's complex and I know they need the time, I will block it out. But I know not everyone has that ability. But at the same time, I would advocate that, yes, we do. We just have to advocate for it, for ourselves and for our patients. Like, even a 20-minute appointment versus a 15, there's more space there. And I think if we're feeling that time is scarce, that mindset is not helpful. If we think, I'm going to create and take all the time I need, but stay within the boundaries and the parameters of what I have to work with, that's more empowering, right? It's the giving our power away with like the scarceness, thinking like time, energy, and money. Those are like our three big resources, right? And it's normal. Our brains go to scarcity. They want to like hold on. That's our like fight or flight. It's like, we don't have enough. We don't have enough health. We don't have enough time. We don't have enough energy, you know, and then if we're giving it away and then it's all gone, and then, oh my gosh, now we're left with nothing. Right. And that's a terrible place to live because it's very disempowering. So empowering ourselves to say, okay, I have 15 minutes. How can I make the greatest impact with my patient today? We're going to like go over their medications. We're going to talk about what's going on, what's the most important thing for them. And I know our colleagues in primary care deal with this. I always say I'm not smart enough to do primary care because they got to be on it and they got to do it. And I know a lot of them, I don't know if patients understand. It's not satisfying for us either. We want to be able to take care of people, right? Like, we don't like the patient mills any more than they do. And that feeling of like not enough. But if we can connect with them just on a human level, like, I write down small details about my patients so I can be like, how was your vacation with your daughter last month or, 3 months ago? How were your holidays? Did you have anything come up? Like, just connecting with them on a human level. And it can take 30 seconds to a minute just to be like, hey, I'm here. You're here. Let's take a breath together. And then we can dive into it. And also reassuring, knowing like we always have enough time. We can always schedule another appointment. we can make things happen, right? But we also have to do the uncomfortable thing of like boundary setting, which I don't love, but it's, but we're setting them out of love for ourselves and for the other person. And then, yeah, I mean, just having the difficult conversations with like our administrators or, our colleagues to be like, that's great that you want to see a patient every 15 minutes to get that RVU or get that bonus. I don't want to practice like that, and then maybe approaching an administrator to be like, something's got to give, but
Mm-hmm.
also believing that we can maintain what we need to pay off our student loans, to do, to survive, to take care of our families, and we can practice
Yeah.
in a way that we want. And we all find different ways, but if we're not aware that it's possible, and I think creating possibility both for
Yeah.
our physician colleagues and our patients, opening that door, because if you don't even know the door's there, you can't ever open it, right? Because brain's gonna brain. They always go to worst case scenario. But if you just take them to the door and say, hey, let's just peek inside.
Mm-hmm.
There's a different way we can do this, and it feels better for us and it feels better for our patients.
Mm-hmm.
And we have less calls, we have better results, we have better
Mm-hmm.
outcomes. The patients are satisfied, we're satisfied, and the more satisfied we are, the more satisfied the patients are, the more satisfied everybody is, and then it's a
Yes.
win-win.
Yeah.
Versus like that lack and attack kind of stress cycle where it's like the merry-go-round that's just spinning so fast and you can't get off of it because you're not sure how. You feel like you're going to like bail and fall off. And that's where burnout comes up. That's where patients get frustrated because they feel like they're not being listened to. So they keep pushing on the same doctor or different doctors. And then
Mm-hmm.
it creates more stress, more burden until they get someone who's like, okay, we're going to stop right here. We're going to break this cycle.
Mm-hmm.
And listening, being able to listen and actually hear a patient and even just sit with them and mirror back to them is so healing for the patient. Like you said, you look at their shoes because you don't want to look at their face, because what if they say something or you read something or the subtle cues, but also going into the room knowing like, hey, like even if you're stressed out, your dog's sick, your kids, got in trouble at school, but being able to like leave that at the door and know that you're okay. You're going to be okay. And you're there to focus on the patient, but you can't do that if you're stressed and overwhelmed. And the patients can't hear you if they sense you're stressed and overwhelmed, because then they're going to shut down and get defensive and be like, well, they're not listening to me. They're clearly distracted. They're clearly not listening. The thing for me, like I have had to practice my listening skills because like my husband says this all the time. Granted, he approaches me when I'm like trying to text someone back and he'll start talking and then he'll be like, you're not listening. I was like, you always walk up to me when I'm trying to do something. Right. But sometimes I'm typing and I tell the patients it's like a joke. I can't type and talk at the same time. So we have the conversation and then I'll start like typing up their plan so I can give it to them. And I tell them, I'm like, you can keep talking. I am listening. But if they say something and I miss it, I'll just say, hey, wait a sec. I was typing. Go back. What did you just say? Right? Because multitasking is not helpful.
It doesn't work. I think not for one.
Yeah.
Liz, this is absolutely like I love, first of all, that you call yourself the personal trainer of your mind and thoughts. I'm going to call you like that now. I think it's just so good. But yeah, I think that it's really important. I think along the way we are losing that part of humanity, right? Like we have it more than anyone else as medical students, and then it becomes harder and harder to keep it. And there is this fine balance to go back to it. And I think when you see the old dogs, to me they are always my most wonderful dogs, because I think they lost it at one point and they gained it back at another point, and that's why they stayed in medicine. So there is the best dog are usually the oldest one. But do you this is a podcast on hope, driven by science, right?
Yes.
Do you have a story of hope that you want to share with us? Most of my audience is some of them are doctors, of course, but it's really also geared towards patients. So what's your story of hope?
So I have a couple different ones, but as you were talking, I thought of another one. I had an older
That's
cardiologist that I took care of many years ago, and he had a progressive diagnosis that there was really no treatment for, but he asked, he said, can I continue to see you and check in? And we had him on steroids and he was getting multiple treatments and he had a lot going on. And we would meet once a month and we would clasp hands and sit and talk. and he kind of imparted on me, and I heard from other people because he ultimately did pass, but family, his friends, his patients would say like he was that doctor that would sit and talk to you. And he told me more than once, he's like, you have the gift. Don't ever lose it. Please keep it going and pay it forward.
Mm-hmm.
And I want everyone that is in healthcare to know that we all have that gift. It gets covered with dirt and mud and, all the stuff that gets kind of like thrown on top of it, like the windshield that gets dirty and we don't have the windshield wipers to clean it back off, and we can lose sight of it. But ultimately, we went into healthcare for a reason, and it's inside of us. And just cultivating that knowledge for yourself and just remembering like someone you helped in the past, especially when you're having a hard day, that no matter what we do, we're connecting with other humans and we're helping them, whether they tell us or not. And finding that validation inside versus seeking it outside, I think was helpful for him and helpful for me. And I will never, ever forget him as a patient because I feel like he helped me more than I helped him. But at the same time, I was willing to take the time, but he was also willing to come even when it was hard for him to walk. He said, like, just sitting with you and talking with you, this is healing for me.
Yes.
And then we'd argue about his allergies and letting his animals in the bedroom and sitting on his head, that kind of stuff. But just realize, like, sometimes the most impactful and healing conversations we have with our patients or with our family members or our friends are not the ones that we think they're going to be. It's not about their treatment. It's about what's really going on with them, what's really hard for them right now. And sometimes it's just smiling or like holding someone's hand or touching them and establishing that human connection. And I think that's the most important thing.
You were saying that, so we'll go back to, sometimes the power of the healing comes just with holding your hand and just being there. Is that correct?
Just being fully present in the moment with your patient or your friend or your family member, and being okay with where you are right now and just connecting with the other person at the level that they're at and not needing anything from them or wanting anything from them, but just being there and present and listening can be more healing than anything else.
I love it. I think it's beautiful. Well, Liz, I think we are done with our time here, but I would love to have you back on the podcast. I have so much more thoughts about how to bring the best care to our patients and how they can be empowered to get the best for healing, right? Can you share with us how we can find you? Where can we find you?
Sure. I am on Facebook. I'm Liz Rook on Facebook, or Thrive Arena Coaching. My maiden name is Arena, and I want to help people thrive. So my husband came up with that name. Kudos to him. Shout out. I'm on Instagram at Dr. Liz Rook. And then my website is thrivearena.com. And I don't know when this will be published, but I am giving a webinar for the Arthritis Foundation at the end of January. I believe it's the 26th at, I want to say 5 p.m. Mountain Standard Time. And it's a free webinar for patients. And we're going to be talking about making small changes, both in mindset and actions, to create healthy habits.
Oh, that's wonderful. Well, thank you so much, Liz. It was such a pleasure to have you. And yeah, this is it. This is the way that we want to offer care to our patients. So kudos to you. This is wonderful. And to our auditors, listeners, again, so this is Dr. Amik from Unabridged MD. I hope you enjoyed this episode. I certainly did. And please share and like and comment. We're trying to create a community here to change the health system and make sure that our patients get what they deserve, because that's really what it is about, because we are all going to either we have been, we are, or we will be patients. So it's also important for us. And we will see you next week. And again, thanks so much, Liz, for coming on the show. Take care.
Thank you so much for having me. Have a great week.
Yeah. Bye.